This is a proposal, but it was just a short PowerPoint that we put together of just some facts and figures that we can present to you so that you know more about what we are all about. So for now, it's just Health for Life Kenya, but we're working on finding a different name for our project just so it's a little more catchy, and maybe adding a Kiswahili word so that it really relates to Kenyans more. So the problem. So at the moment, Kenyans are facing the following health-related issues. So there's physical inactivity, obesity, diabetes, poor nutrition, inadequate sleep and rest, self-concept problems, poor hygiene and sanitation, poor hydration, stress, bad posture, high blood pressure, and hypertension. So some facts and figures for that is that the World Health Organization decrees that all 5 to 17 aged kids should be achieving roughly an hour of moderate to vigorous intensity physical activity, and it's found that Kenyans in many areas aren't actually achieving this. So rural kids in Kenya achieved a mean of 156 minutes a day, which is found in the ISCO study. And it also showed that among urban kids, it was only 12.6% achieved MVPA, which is the moderate to vigorous intensity physical activity. And on average, they had a mean of 36 minutes a day instead of an hour. And in rural and urban areas, only 35% of children met the MVPA guideline. In rural, it was 60% of males did and 50% of females did. So there we can see the gender discrepancy. And in urban, it was 20% of males and 12% of females. And in urban areas, 23.6% of kids were overweight or obese. And it was found that the most obese children tended to be from private schools, and it was more girls, which was, again, kind of the gender discrepancy. And the high blood pressure in rural Kenya was between 18 and above, was an estimate of 47.5% of people aged 18 and above had high blood pressure. 3.3% of Kenyans have diabetes, and that's predicted to raise to 4.5% by 2015. And poor nutrition, so that we were looking at undernutrition as well as overnutrition. So it's manifesting as obesity and overweight issues in urban settings, and then malnutrition in the rural settings. And then we had, for the self-concept issues, was just the problem of people having issues related to their body image and their self-esteem, and as well as mental health. So things such as depression and stress have been an issue among Kenyan teenagers. And then there's poor hygiene and sanitation, which you pointed out is extremely prevalent in this specific county. And then poor hydration has also been found. So it's recommended that children have roughly 8 glasses of water a day, but that's just a rough number. So in areas such as this one, where it's so hot, people should be receiving more. And it's found that children are often not actually getting that much water. And when they are drinking that much water, it's not clean water, so they're not getting the benefits that they do need. And for hypertension, 23.7% prevalence of hypertension in rural Kenya. So that was the problem. So our solution. So for the short term, it would just be to improve the knowledge, attitudes, and practices of healthy living among Kenyan youth through a variety of initiatives. So small initiatives that we thought could be implemented, and of course we would need your feedback for this, would be making posters or videos and school visits and using leaky tins to help with water issue, mandating physical exercise and improving school meals. So kind of going to schools that provide their students with lunch, or boarding schools, and looking at what they're feeding their students and giving them opportunity for switching ingredients that they use to make it a healthier option, and also helping them look at what would be most economical for them. So we understand that a lot of schools don't actually have budgets to be buying extremely healthy food, but showing them low-cost food that's slightly healthier than what they're serving their children now. And then the long-term solution would be, the long-term goal would be the implementation of a Health for Life curriculum in Kenyan primary as well as secondary schools, whether it's its own course or just a section or unit of another course. And we thought that implementation of the course actually in school would ensure that all kids, regardless of their gender or where they live are going to be achieving the education. And we decided to target youth instead of adults because, as Esther was saying earlier, youth is the future. And if we're able to teach our youth, it's a lot easier to change the practices of young children than it is of adults. So if we can change their habits, and then they will continue to have those habits into adulthood and pass it on to future generations. So we thought that just that would change the face of Kenya a lot more efficiently. So the social, we'd improve the mental and physical health of the population just through education, and ensuring that children are eating well and are exercising and are taking control of their mental health. It would also alleviate health-related stress because we know that in families, if you have, especially in rural areas like this, where people don't have extreme financial means, if they have a sick child, it poses a huge stress on the family. So just alleviating that stress would be extremely helpful. And Kenya has a really high young dependency ratio. So if we're able to target the youth and help them, then the effect of that dependency ratio on the population would be reduced. And also tackling the youth means that we're tackling a huge percentage of the population. And then economic would be, it could save the government money in the sense that the government is spending so much money on diseases that could be preventable, such as type 2 diabetes, or people that are suffering from diseases because of obesity and all the sanitation-related diseases. If we were able to curb the effects of those and maybe eliminate them, then the government would no longer have to spend money on those diseases. So our mission is to make the project as county-specific as possible so that they can be the most effective as possible. So we need you, the county government, to provide us with the information about your health status and your plans so that we can work from there and ensure that everything that we do will be the most helpful for you guys and make sense in your county, so we're not trying to teach your kids things that aren't going to be applicable in their lives. And we'd also like to use this county as our baseline study, and then you guys could be a model for the rest of the country. So we could take what we've implemented in your county and hopefully the success that it has yielded, and then show other counties all over the country, you guys as an example, to help improve the face of the rest of the country. And lastly, in order for us to accomplish your goals, we would love to have the cooperation and support of your government, because our accessibility to schools and resources is only so vast. But if we have your partnership, then it would just be, we'd have a greater impact and influence on the schools that we go to or the people that we approach.
What you're postulating is very real. And I would want to say thank you for your thinking is a thinking that we have. And the ultimate of what is likely to accrue from this kind of proposal will really help us maintain and up the name, the County of Champions. I want to assure you that we will give you the necessary support, because this is what we believe in. We want more champions from Elgeyo Marakwet. This is noble, and this is, you are like answering some of the things that we've desired. We've been asking ourselves, when will we be able to write to get the right data in terms of what is happening in the county? And now that you're saying you want to use this county as a baseline study base, then we would be able to have the facts with us, and that is what we need. So you're most welcome. We'll give you the all support.
We are so grateful. We have seen your intentions. And I would want to appreciate that I have seen various issues of health have been addressed, which have actually been a problem to us, but we are actually planning to really work towards them. I have seen you have something that does with leaky teens, which is very important in our schools, and that is the direction we're actually heading. Now that we are there, and now that we are soon becoming the baseline and a model for other counties, we will be there. We will truly support you. And I believe coming 1 or 2 years, we will be reading maybe 10% or zero in these communicable diseases, and especially the water and fecal related. I'm also impressed about the means of which you would want to pass the information through videos. Some time back, a few years back, I managed to educate the youth on HIV/AIDS, and it was actually very positive. The results we achieved was good, at least there was change in behavior among the youth, really seeing how one transits from engaging in bad behavior, in bad sexual behavior, to acquiring HIV/AIDS, even to the point of death. And it was actually very educative. It really remains in the brain of that particular youth on how one gets transmitted. If we can have sanitation videos that really can help educate this particular population on how can one be able to be transmitted this particular condition up to the final stage, then I think they are going to really get and understand, conceptualize on how all this transmission of disease can occur.
Do you have any program, or would you benefit from a program that makes sure that children in school are given the right to play according to, of course, the United Nations requirement that children have a right to play, and that they need a certain minimum amount of hours to play? You could answer that in the context also of how do you ensure PE lessons are used for physical education classes, not for teaching mathematics in our schools?
This is one of the key areas we've been looking at. We've just established our educational board in the county. And one of the clear mandates that we've articulated among the board that will be in charge of education is to tell them, please, let's take physical exercise as a lesson and not cutting it through to engage in something else like maths, English, or Swahili. And I want to tell you that the good aspect of Elgeyo Marakwet, one of the key income earners is sports. So rarely do you find teachers might not be there to engage students in their physical exercise, but they would be able to tell them, run around the track like 5 times, 4 times, but not really engaging them in the physical exercise. I think we need also to go back and engage our trainers, and I think Daktari, you will attest to this, that most of the times, even at the university, rarely do we really teach physical exercise as a lesson. So I think we also need to really go back and inculcate, even in the training aspect of a teacher, to really know that physical exercise is a lesson. But you find it is in the timetable, but nothing much has been done to develop physical exercises, even among the training teachers. So you find that what they know, engage them in a play, and that is the end of it. But in Elgeyo Marakwet, we've told our teachers, kindly let's engage our students in exercises towards, as we look at sports, as we look at identifying and nurturing talent.
So have you noticed in this county any differences among the genders in their access to sports, or the extent to which girls versus boys actually participate in sports?
If you come to attend, like on Thursday, you'll get about 900, both men and women, running the same route towards a finish. So you find that there is no gender discrepancy in terms of engaging and sports engagement. At least both, the stadium that we have in this county has been built by a lady called Ilona Kiplagat. So that's the only functional stadium built by a lady. So you find also girls are also saying, here we are equally like the way boys are. So there is no, the gender aspect, there is no discrepancy. Like last year, we sent a team of 49 that were going to London. Out of that 49, there were 13 from Elgeyo Marakwet. So you find that if you look at the ladies and the men, maybe a difference of 1. And we would be able to say there is no discrepancy in terms of looking at the gender, especially in sport development. We are for the idea. We will support you and give you the maximum support towards giving us the awareness and passing knowledge to our people.
We look forward to working with you in order to achieve this intention. And after that, other counties will actually marvel at you as a model county. While you'll be flying, they'll be starting to crawl in order to fly. Okay? Yeah, so thank you very much.